Hello, everyone. Hi, welcome to Blumber Healthcare Podcast, where we bring you journeys of individuals who are not just part of healthcare but are shaping it with purpose, values, and leadership. Today, we have with us Dr. Bhuvaneswaran, an accomplished cardiologist, academician, administrator, and a deeply grounded human being. From growing up in a small farming town near Coimbatore, shaped by strong family values and a life revolved in service to becoming a trusted cardiologist and now leading one of the most respected healthcare institutions, PSG. His journey is a powerful blend of humility, excellence, and purpose. Beyond medicine, he is also a philanthropist, a mentor, and even a musician, reflecting a life that is so balanced as it is impactful. He is also someone who deeply values his personal relationships, uh, a reflection of a strong foundation that complements his professional journey too. In today's conversation, we will be exploring his journey, not just about the evolution of cardiology through his lens, and also how clinical excellence translates into large-scale leadership, healthcare leadership. Hello, Dr. Bhuvaneshwar, and welcome on to our podcast.
Hello.
Namaste. Thank you so much for joining us today. It is such a blessing to have you here, Doctor.
And in fact, I'm equally happy that I get interviewed by somebody who has a very nice vision of sharing such type of podcasts and interviews to aspiring youngsters to really take up something for their future career.
Yeah.
So I really am very eagerly waiting to see what type of questions you have for me.
Okay, definitely. I'm looking forward for this too. So you grew up in a family which was rooted in farming, right? In near Coimbatore. So, what has been the strongest values that has stayed with you all through from your childhood?
Actually, I honestly wanted to be a farmer, agriculturist,
Okay.
from a very strong family of agriculture, especially with we own a lot of farmlands. So like my father, I just wanted to be an agriculturist. But my mother was one who was so adamant
Okay.
that he wanted me to take up medicine.
Mm-hmm.
And after that, she started putting it in my mind when I was even in kindergarten school.
Mm-hmm.
So I remember my friends telling that I used to play a doctor patient. I
Oh,
used
okay.
to
Okay.
match or some stick and give injections, things of that kind. I forgot what some of my school friends used to say.
Wow.
So I would credit my mother to be the person who had put this in my mind.
Okay.
And see, the most important thing when you are growing up with as a farmer and agriculture, what I want to really give this message to a lot of people. In fact, if you see, this is almost like a Gurukula, where see, we grow with the nature.
Correct.
See, if you here we grow with a cow, we grow with the bull, buffalo, chick and hens, and goats.
Correct.
And we used to have, really, we used to go climb up trees,
Yeah.
be in touch with nature,
Yes.
swim. Now you may wonder how does it matter? It matters a lot primarily because we have been in touch with nature, and we used to really see, and we are being a village. It was not a very prosperous and not a very flashy place where I grew up.
Okay.
So we were to get in touch down the line when I see a patient, whether he's rich or poor, I could always get down to their level. And felt that, growing up in a village gave me these two important things. One is a part and parcel of India, like what Gandhi used to say, no, if you want to see India, go to the villages.
Yes.
So I grew up in one such village. Same way. So I was always in touch with nature, and I was I became a better sympathizing, empathizing human being because I grew up with that.
Wow, that's so nice. So, as you said, touching the soil, being with the nature, amongst animals, growing up with the trees, growing, that is truly making somebody being grounded. Yeah, I truly agree with that. So, along with having such kind of beautiful environment, you also were part of a close knitted family, which helped you like have the kind of responsibility, empathy, which is again coming from the values that were imparted into you. How did that shape you, doctor?
So obviously, we belong to a joint family system
Yeah.
where I had three generations of people. I was the youngest generation. My father and our grandparents, grand uncles. So, and as I told you, with animals and the people, ours is a very large house,
Okay.
and so every day some 10, 15 people will come for to ask for food. We used to provide food. Our parents, they have that what they say, they sowed that seed of dharma, like philanthropy, charity, and in fact, my father was some sort of he was a village doctor also. Like he's not exactly a doctor,
Ah.
but he used to treat some simple ailments with some common remedies.
Okay.
So I have seen my father treating a lot of people. Somebody will come and say, "Sir, I have a pain here," and somebody says scorpion sting. Somebody says that I have a sprain. All these type of things he used to prescribe. We used his oil, and we used to prescribe some simple herbo-mineral medicines, which the company is still there, called as D-Chain, J&J D-Chain.
Ah.
They are herbo-mineral, and they have some very good home remedies. Simple remedies for cough, simple remedies for some fever, cold, cough. So that joint family system gave me, number one, as I told you, the support
Huh.
as a human being. And me seeing my father treating people with simple ailments, and to be very even now, although I may be a very senior doctor, this, that, and all, but I used to take simple medicines only for the common problems. I don't for elaborate medicines, and I advise everybody also for simple things. Do not for nowadays everybody with just a fever they go to doctors. That should not be the way it should be looked at.
Antibiotics
So,
has become as common as chocolates.
chocolate, yeah. So, saying that, I say that a joint family system gave me that the environment to be more mature, more be into communicative, because my communication skills, it matters a lot, especially when you grow up in a larger house with many children, so that you don't think that you are the boss, like you are with many others, your cousins. So in that way, we grew up excellently well with that environment, and that gave me, number one, as I told you, it gave me an insight of how to live in a community.
Understood. You also mentioned once that you were into a lot of dramas. You used to write dramas. You were also a fan of singing. Not, I'm sorry, MGR songs, right?
Oh my God! Actually speaking, see, I probably from my childhood I am a 360-degree person.
Okay.
Like I used to be always a topper in the class. I used to be really the pet of all this because of my academic, I used to do quite well. And till I completed my DM, I have always stood first in wherever I have appeared. Having said that, I was very, very fond of artistic, and I used to play roles. I remember my first role was as Nehru Mama. I did Nehru, and I was in the second standard or third standard. Then my sixth standard, I became the favorite gypsy girl of the school, because they put me into a girl's costume.
Okay.
And I used to be very chubby, fair, short, and plumpy. So people thought, I would suit a girl's role better. So somehow I became that. And since then, even till now I anchor a lot of shows now. I become a moderator for debates.
Oh.
I do even some radio jockeying whenever I get an opportunity.
Oh,
I conduct shows, so that all that this has been a part and parcel of my growth.
okay.
But I don't think I have always shied away from sports, except some minimum, like I have played cricket and some shot put, but never used to like running, those type of aggressive games I've never played. I've played only gentle games, I've played tennis for a few years, shuttlecock, but other than that, I've never gone for a very aggressive. But art has been there from my childhood, especially singing, comparing, dancing, debating, participating in dramas, etc. I have gone a long way. And I will tell you, as a medical person, I always say that we have two sides of our brain. Left side of the brain is a logical brain, which tells about your academics, your intelligence, your mathematical capacity, type of a logical side. The right side of your brain is very, very important for your emotional growth. So I always say that a medical person especially should be a very, very well balanced in his logic and emotion. And probably I have always seen somebody who's always good in artistic expressions in life. They have been good doctors. Many doctors have been either painters or singers or debaters. They excel very well. So in that way, I always say that it's very important that a boy or a girl should get exposed to academics and arts, probably some sports.
I remember you saying in one of our conversation, you used to sketch a lot to depict what you're trying to say. When you were growing up, writing answer scripts also, when in your answer scripts, you used to depict what you were trying to say in that answer. And that helped you a lot even when you were doing your MBBS and your cardiology, sir. That's,
Yeah, see, I remember, usually when I was in school and all, we used to write our answer papers in ink pen, and we used to use pencils to draw the pictures.
yeah.
So I'm always, whenever I have to show something, I used to create my own diagram, and that was always appreciated by our teachers. And I remember that fetched me a very high mark in my school exams. That continued in the college, medical college, where anatomy, whatever it is, I used to have two methods. One is drawing a structure. Other one is, if you are talking about a process, I used to write the process in diagram.
Yes.
So, for example, one leads to two, two leads to three, three leads to so. That type of depiction have always fetched me better marks in most of my so being expressive in that way has been probably, I don't know, so I found it very nice. Even now, when I have to sit and explain to a patient, I used to take a paper, draw a heart, show them on your valves, this is how, and what is bypass, what is plastic, all that we can show them pictures is one, but when you actively do it, that makes many of them after the conversation have asked me, sir, can you please share that sheet with us? So like that. So interesting.
Actually, doctor, I also feel that when you sketch, when you draw, or when you do that flow chart that you mentioned right now, I think that is kind of visualization also. Like, it gives us a clear picture of what we are trying to achieve, and we are backstepping it of what we are doing now to achieve that. So that is that visualization kind of helps in every way. I think maybe that has been with you all along. And yeah, so you have transitioned from, I mean, during your school you were in the Tamil medium school, and then you transitioned into English. You had to adjust that, and but then you still achieved a lot of gold medals, right? I think I remember 14 medals was what you mentioned in your MBBS. How did that happen, and what were your struggles?
See, actually, as I told you, I studied in a village school where we studied in a pure local Tamil medium, and English used to be a paper, a single paper. So I used to have only one paper as English. So that when I went to, so we belong to that old system. In fact, I was the last batch of that secondary school, SSLC, then followed by the pre-university, and then pre-medical and medical.
Ah,
So,
okay.
that's the last batch, after which the plus two, 10 plus 2, that plus 2 became like a junior college, and then people used to go for a MBBS without preschool.
Oh,
All that happened after my batch.
okay.
So in pre-university, when I came in, it was all in English.
Okay.
But most of the time, they are all written English. And although we were not in English medium in school, we had special attention given to us through our English grammar classes, as well as we had separate person to teach us the written English. We were reasonably good in written English, but spoken English is a zero, nothing. So then suddenly, I was put into Stanley Medical College. I was really, it was something like fish out of water. I couldn't speak at all, and this was noticed by one of my batchmates. He is from a convent. In fact, he was a student of Don Bosco,
Oh,
one of the elite schools of Chennai.
yeah.
Now that was called as Madras. So when I joined Stanley Medical College, I really felt out of place. And not only, there were so many of us from villages.
Okay.
In Stanley is something unique, where we used to have around 100 out of 180 people. Around 100 people will be from villages. 80 people will be from the cities. So I was not alone. There were so many of them, and some of them, they never used to mingle with others.
Okay.
This person from Chennai, the Don Bosco friend, he picked me up. He said that, Bhuvan, you should start talking to me in English. I'll tell you, for the first 1 year, he gave me lot of confidence. He used to talk in simple sentences. Then 15 years. Then, that was one. And I have to really again remember, I always say as a joke, if you want to learn a language fast, ek tujhe ke liye style, you get a lady to talk to. Then, as a young man, you will start picking up the language much faster.
Okay.
Story of the Ek Tujhe Ke Liye. You must have seen that movie where Kamal speaks in different slangs of Hindi.
Okay.
And same way, I got some good friends who again encouraged me. And when you are as a young man, when you want to talk to a girl, you make sure that you speak in a decent way.
Okay.
And that again gave me a lot of confidence. And let me tell you, my second or third year, I was reasonably fluent.
Okay.
And that continues even now. So what I want to tell, I still remember when I had, after my MBBS, my MD, my DM, I presented in a national podium for a prize exam. The best prize of the presentation. That video I brought and showed it to my father. I still remember, he was sitting, it's about 10 minutes video where, I was wearing a suit and I was talking in the podium to the national audience, which gave me the what you call as Dr. D.P. Basu Award. It's one of the highest awards for postgraduates at that time. And, my father, the reaction was, he was just sitting and he started crying. So seeing him, I felt so emotional, and then he held my hand and said, we could not educate you in a convent or somewhere. We could afford, but we didn't have such schools in that place.
Correct.
But we were reasonably a well-to-do family. He said that, we could not afford to put you that, because we don't have such type of schools in only
The locality.
which is about 100 kilometers, and my parents are not keen to put me out of place.
Okay.
So having said that, and then he asked me, he was not, what struck me, how did you start speaking English so fluently? That was, I would say that's like a Nobel Prize for me. When your father comes and tells you that, and I give the whole credit to my friends.
Friends.
And most important is, I was never, I'm always a competitor. Like, I will never say that why can't we do? I will always say I will do.
Yeah.
And I had a very good inclination for languages. Even now, I studied in Kerala for my MD, I mean DM, and Karnataka for my MD. I studied in Manipal for my MD.
ಹಾ
So, I was the mom.
ಕನ್ನಡ ಬರುತ್ತೆ.
ಅದೇ അതുപോലെ നമ്മുടെ മലയാളം സംസാരിക്കാനറിയും ഇത് all these languages I could pick up primarily because I never hesitate to speak, I never hesitate to learn, and that way the transition from Tamil to English was successful by third year. There was no turning back.
Nice, nice, doctor. So that's very true. A person who has a keen interest to learn, continuously learn, and educate ourselves, I think growth and success is kind of right there. So, when you were doing your MBBS, and at what stage did you decide that cardiology is your BI?
Actually, you should know that cardiology is actually the third level.
Okay.
So we have a primary level, secondary level, and the tertiary level. MBBS is called as a primary level. Okay. After MBBS, in fact, I came out as the best outgoing of my college, Stanley Medical College, with a lot of medals. But unfortunately, there I want to quote because of the seat allocations were based on your what you call as the community based.
Okay.
So I was forward, so I couldn't get a placement in the government hospitals then, government colleges. I was really heartbroken in spite of me coming as a topper in my college. Then what I did was I came back to my parents. My parents said that there is a college called as Manipal College where you can pay a capitation and you can do your post-graduation, and I opted for general medicine. So that is the second level. Generally, cardiology is a third level. So my plan was to qualify as a MD general medicine.
Okay.
After which I will come back home, construct a hospital and practice. That was my plan.
Okay.
So what happened, interestingly, I was, the moment I entered Manipal, see my MBBS was between 79 to 86.
Okay.
87 I entered Manipal. At the same year I got married.
Okay.
And so I finished my MD in 89. And my plan was to go back home to my hometown, Govichettipalayam, and construct a hospital.
Okay.
What I did when I came, my wife is from Coimbatore.
Okay.
So my father-in-law was very well connected with many of the hospitals here.
Okay.
Said, why can't you have some exposure to some hospitals so that when you go back home to start your practice, you will have confidence. So I entered one of the multi-specialty hospitals, then the very famous one in Coimbatore called as PSG Hospital.
Okay.
When I entered there, I realized that even in 1990, when I was at post-MD, specialty degrees like cardiology, neurology, nephrology was already there.
Okay.
And so I realized, stopping at that level, there were superior degrees available, and I started feeling that, oh, if I don't do higher level of studies, I cannot have standing in the community.
Okay.
This was so my ideas changed when I started working in between. And then I was guided by a few local cardiologists. And my interest in cardiology is primarily because cardiology is a very fascinating science. Generally, when you say in general medicine, people from MBBS stream, people who are really intelligent and intellectuals only choose medicine.
Okay.
That's how we say that, although others may dispute that. Right. And having selected internal medicine, in fact, I came first in Manipal also as I won the Rama Gowda Gold Medal in KMC Manipal.
Oh, wow.
And I realized that doing a higher specialty and my interest was in with heart. So that is where I started appearing for entrance exams. I got staged by the first attempt of my entrance exam in Trivandrum, Sri Tirunal Institute of Medical Sciences. I got my DM cardiology. So you have MBBS as primary, MD as a secondary internal medicine, and DM cardiology as a tertiary care, we call it.
Okay.
So at that time, it's a price catch because Sri Chitrai Tirunal is a central government sponsored institute, aims.
Yeah.
So it comes under the Department of Science and Technology.
Okay.
They have only 4 seats, only the 4 seats for DM, for which more than 500, 600 doctors all over India will write for an entrance exam. After the entrance exam, we have 2 levels of screening. We have clinical exam and then final interview. Best part is they start on the morning, next morning they complete and announce the results immediately.
Oh, 2 days.
It has a very transparent way of selection. And by the Almighty, I got my DM cardiology. By the time my son was born, in fact, so I joined for DM, and that's really just for you to know, Sri Chitrai Tirunal was paying us a stipend of almost 13,000 rupees then.
Whoa.
I'm talking about 1991.
Okay.
The price of petrol was 10 rupees.
Yes.
And so they gave us a quarters. So it was a wonderful 3 years where I studied cardiology in Trivandrum, all these supports.
While studying, you were also practicing general medicine.
See, actually, cardiology is a sub branch of general medicine.
Okay.
So when you do DM cardiology, we do everything about cardiology. And having a medical background will give you a lot of strength in managing some other medical conditions like diabetes and some infections. All that metabolic issues we can manage. So it is something like, you become a general lawyer, then you take criminology. You become so you will not deal with the civil cases. Generally, you will take criminal cases. Like that, when we choose a subspecialty like cardiology, we become experts as cardiologists. So generally, cardiac problems and management of them.
Understood. So, doctor, you said once you came back to Coimbatore, you understood that there is a need for another layer of specialization, and that's why you chose cardiology. And you were also guided. Was there any specific reason? Like, was there anything that spiked your interest towards cardiology?
See, there are many medical specialties, especially medical specialties are non-surgical specialties. So for everything, they write only medicines.
Yeah.
So cardiology is one branch where you not only write medicines, you can do a lot of non-surgical interventions. For example, now if you are a lay person, for you to understand, must have heard about coronary artery stenting.
Yeah.
Yeah. See, earlier when somebody has a heart issue, they have to do only open heart surgery.
True.
But now, almost 70% of what surgeons do, we can do without surgery.
Oh.
They call as interventional and structural cardiology. When cardiology was one of the most glamorous subjects, primarily because one subject where we not only read but we can execute a lot of non-surgical procedures with excellent outcomes. So that is one primary reason where in fact cardiology was a real hot cake. Anybody who's in MBBS, if you ask what do you want to become, cardiology. Even that now the number that has come down, but still it is something very, very precious and close to many aspiring young people because cardiology you don't only speak, you do.
Back then, when you chose cardiology, doctor, how was it evolving in India? Like, what was happening in the?
That was the time it was taking off.
Okay.
See, cardiology, in fact, before 80s, I'm talking about before 80s, there was mostly surgical procedures, and able to detect and diagnose the problems. We have a lot of limitations. In 80s to 90s came the echocardiogram came between 80 and 90. After 90, the angiograms, angioplasties, all those things came. And after 2000 to 2010 is a golden time for the interventional cardiology. Now I'll tell you, now we are in an era where even a valve replacement can be done without surgery. multiple valve replacements can be done, multiple blocks can be removed without bypass surgery, and somebody you can fix a pacemaker which can detect arrhythmia
Disturbance.
or
Uh-huh.
irregular heart rate, and it can give internal shock
Okay.
and it can pull the pumping. That is nothing. Now we are somewhere in a different plane of cardiology.
Understood.
So it's a fantastic science, and the growth has happened over this last 30 years.
Understood. After you became a cardiologist, you have been handling patients of in high volume, right? Like 100 plus, you said once in a daily. But you have a team. I understand that. But what does that teach you, like about the clinical judgment? Like you have to do your like if you have to look at so much high volume patients, you need to make judgments or take decisions in minutes. And how do you go about it, and how did you reach that stage, doctor?
Pushpaji, see, first of all, I've been brought up in such a background. Till date, I'm always a person who's grateful for everything. So I've been grateful for getting into medicine. I've been very grateful to have qualified, and I have always taken what we call it in Sanskrit as a bhava of a good instrument. I'll tell you, my way of practice of my medicine till date is I never take any credit for whatever I do or whatever I say. But I have been always taken a bhava or the attitude of a good instrument. And I would love to interact with my patients. I've been always honest in supporting them and giving them good words, a smile, a tap. And being in a medical college as a teacher, I know I'm very proud to say I have inspired a lot of my students to have become cardiologists, which when they come and see and tell, sir, I took cardiology because of you. Because in fact, some of my boys who have studied under me have become professors, and now they come as examiners to our own institution.
Yeah.
So what I want to tell you, it's a God-given opportunity to really transform somebody's life. I always call it a transformation. Because you know that when you are dealing with a sick person, you're able to understand and empathize that, and give them the true support, and if God has given you some skills to practice it properly and do it, and I'll tell you, you are really blessed to us. That attitude should be very important. Because I want to honestly say that I see that there is some reduction in that value.
Yes.
I won't say it disappeared.
Yeah.
I think it's very important. Many of us, when we have started working, we have looked at our the fee is as per our service. We have never worked for the. We know that when we do a service, we get a fee. Okay, so what I try to say is the monetary benefits were outcome of a good service. But why I say that value should be maintained. And if the medical profession starts losing that, then it becomes very different. It becomes very different.
Yeah.
Yeah, transactions.
Yeah.
So I want to say this very clearly. It is a very, very valuable profession with values. Medical profession is so much of values. I have studied excellent doyens of medicine, including I'm a very pet student of Professor B. M. Hegde. Everybody knows Professor B. M. Hegde.
Yeah.
So I know that there are such people who instill so much of values in us, and we are very, very indebted to such people.
Yeah. So I do see a lot of videos from Dr. B.M. Hegde, and he gives such prominent insights about how food is a key and how it is important to eat in a certain way, certain direction. I do it.
Yeah. To be very honest, see, we have one of the treasures of science, and but all these things were subdued by the English invasion, and they brought in the Western medicine,
Yeah.
which started dominating over our sciences. And many of our sciences, the evidence creation, though that type of approach was never there. So somehow, our sciences were subdued. But I'm telling you, Western medicine has got its own values. It has tremendous values. It has cured thousands of people. It has helped so many people in emergencies. But our medicine has its own rich tertiary values.
Yes.
And I'm very happy to say that I don't know whether you have heard about this term, integrated medicine.
Yes. Yes.
Coming up in a big way, even abroad it's coming up.
Okay.
Where, many of them, in fact, we should really compliment our government of India, central government for Ayush, where multiple streams are coming in. But most important thing is everybody should know their limitation.
Yes.
The factory should not come in.
Correct.
So that way, and I say that the multidisciplinary approach to any ailment can be of tremendous use, especially not in emergencies, non-emergency situation, a chronic problem. You should be able to do multiple methods, multiple approaches.
Understood. So, in today's world, doctor, like you have seen cardiac patients from like 40 decades, 40 years now, 4 decades, sorry, 40 years now. So, what are the few common patterns that you see in human as in general, where you see a lot that these people are developing heart diseases, and that listening to their patterns or their way of life, you can say that this guy will definitely be a heart patient going forward. What are those common
See, in fact, the science is very simple. See, every human being is, we are all made up of materials, and we are so-called, we are alive by a soul or something. Because nobody else knows exactly, even our science does not know. We know that, there is electricity, bioelectricity inside us which make us happen. And if the bioelectricity is not there, we are called as a body, we are dead.
yeah.
But nobody knows more than that. But having said that, including this, then we have something called as a mind. Because mind is one of the most debated subjects in scientific medicine as well as in the traditional medicine.
Yeah.
So I strongly believe that somebody gets into a disease because of three issues. Number one is basically your genes. See, all of us inherit genes.
Correct.
Genes give us the shape, size, color, and they give us the hair, whatever you call it.
Yes.
And they give us the propensity for a disease. So this is called as the genes. The genes contribution.
Heredity.
Yeah, heredity.
Yeah.
The second one is called as the agent. For example, when you have a strong infection or a strong influence for you to get a disease, that is coming to you. If your gene is strong, that will not affect you much.
Okay.
If the gene is weak, it can affect you much. In between these two, there is something called as environment. So we call it as a seed soil theory. So if the soil is your gene, the seed is the infection or the harming agent. For sunlight or moonlight or water or temperature is environment. So if your soil is very good, that means you are vulnerable for a disease. And you get a good seed, and it is supported by well, you will have a tree of a disease.
Okay.
As if the soil is not good in the sense, not good as a soil, but your genes are strong, even a strong seed cannot harm you. And it is not supported by the environment. So that means everywhere you may have to understand your basic structure, and which is made up of your mind and body, which is decided by the genes and surrounded by your habits and your day-to-day life. Everything is called as environment, and an exposure to toxins. It may be tobacco, it may be alcohol, it may be corona, it may be whatever it is. So all this. So that means no disease is one-to-one. It is always these three factors in permutation combinations people get. And let me tell you, not every disease can be explained by this. A small example, you may see some 1-year-old child which is born which has a leukemia. Now, what did the child do to get that leukemia? Nothing.
Nothing.
Not an answer.
But a gene is there, right?
Gene. But what I try to say, there your environment and your all
Aging.
those part.
Understood.
So in that way, many of the diseases, that's what I always say, even no disease is predictable in the mathematical way.
Yes.
In science, especially in even a heart disease, 1 plus 1 is never 2. 1 plus 1 can be 0, 1 plus 1 can be 100. So there are people we have seen without any risk for a heart problem developing heart problems. And there are people whom we think that they should have a heart problem, will never have a heart
Never
problem.
had. So patterns can never define human.
It's always the third factor which operates.
Understood. So the human body, which is unique in itself, like each human body is unique in itself, and no pattern can define what will happen with which human.
Exactly. It's something like, I'll give a simple example. You go and see, just stand in the place, see the road. There may be one fellow who may be driving very slowly. So we always say that when you drive slow, you don't get an accident. But somebody will come and bang from back.
Yeah.
Whereas you will see another fellow, you might see people going,
Yeah.
you will say, oh my God, he's going to have an accident. He will not have
Not
anything.
have anything. Yeah.
But so then what does science say? Science say when you go slow, the chances of accidents are low.
Low.
But we
That's
never
true.
say that you won't have an accident.
Yeah.
And on the same way, when you go fast, your chances of accidents are high. But not that all fast drivers meet with an accident. So this is how the system works.
True.
And it may sometimes appear, but this is the truth. 100% I'm talking because this is how the diseases happen nowadays.
Understood. So, doctor, over the last 20, 30, 40 years that you have been practicing, what has changed in the cardiology? Like, how has it evolved in terms of diagnosis, interventions, outcomes, technologies used? How has it evolved?
See, it has evolved positively and it is evolved negatively also.
Okay.
That is the positive side. The positive side is now we have almost excellent technologies to diagnose heart problem and excellent technologies to treat either by medical or surgical or interventional or by other methods. So I'll tell you it has been a super success. But the negative side of it is basically, see, we always we had adequate time and mind to treat patients, spend time with the patients, and ensure that every patient is taken care in a positive way. And we were not treating the test results. We were not treating the investigations. We were treating people. But now with so much of increase in the disease and the many of these people become so busy, now you see patients themselves come and tell the doctor is too busy for this, they are not able to spend time with us. So that means you understand. So somebody has a disease, see, I used to say that I have a patient, he comes to see me, but now it is not in that way. Somebody sees the patient, somebody diagnoses, and somebody else treats.
Yes.
This type of, finally the outcome is probably the same. But the charm of medicine is that you participate in the patient's cycle.
Overall.
That should become more stronger. I feel there is a negative thing which has come off late is that many a times. Many doctors they don't even know their patients. Sometimes it happens in that way.
Yes.
Some doctor operates and walks away, and the patient doesn't know who has operated also sometimes. So it happens. That should not be there. So I think that's what I can say. So cardiology has really blossomed very well.
Okay.
And in fact, as I told you, I studied and passed out of Sri Chitra Internal Institute. And we have a WhatsApp group of all our Sri Chitra doctors
Okay.
from our teachers.
Okay.
Sri Chitra was founded in 1983.
Oh, okay.
83, now we are almost this. In fact, we just recently celebrated our 50th year.
Oh,
Having said that, I want to tell you, all of the senior professors share the same views. Now, many of the current generation of people are too fast. They want to do too many things. They want to. They feel that there should be the medicine should be evidence based. Not just evidence based. It should be weighed the pros and cons, and then something to be done.
understood.
It is again like you have all the right to drive the way you want, but ensure that you don't make accidents.
Understood. So, if I have to put it like this, it is more like the cardiology as a field has evolved beautifully well. Like, lot of inventions have been made, lot of discoveries have been made, and treatments have been more positive and more successful. But then, what you say is that as a doctor, the human element of treating a patient and knowing the patient personally and trying to evaluate what his issues are at a personal basis, that is what is missing, and that needs
I would say missing with all.
Okay.
Overall, there is a reduction.
Reduction. Okay.
One year when probably out of 100, if 70 were practicing, 30 were not practicing. Now it's come down still the numbers.
Okay.
So even earlier we had people who were very aggressive, very rash, and now that tendency is more we feel.
So, doctor, in the current world, what kind of misconceptions do patients have when about their heart diseases? I mean, generally, sorry.
I won't say misconceptions. See, nowadays it's everybody is a chat GPT doctor now. Very, very unfortunate. Why I use the word chat GPT is because we used to say Google doctors. But I'll tell you now it's going really funny. I won't say it's dangerous, but it's very funny. Because there are people who come thinking that they have read cardiology in their own way.
Okay.
And they come with such notions and things. I would say that when you have these gadgets to educate you is better. I would say, I'm sorry to say that there are more people who's there because it becomes artificial intelligence. There is no true intelligence and logic in what they have understood. But having said that, I honestly feel that the many patients they know what to do, they know what not to do to a reasonable extent. And knowingly, they don't do anything possible. They know that if you do this, this is wrong, but they continue to do it. It may be eating, it may be drinking, it may be smoking, it may be anything for that matter. And I don't think anybody should tell them that this is wrong, this is correct. Especially in sometimes now I see in India the true rural areas are very remote of late. It may be only tribal areas, otherwise we have almost urbanization in every town.
Yes.
Urbanized.
Yeah.
Having said that, everybody knows, but they know doing something is wrong, but still they do.
Still they do it. I agree. It's like even if you educate, people are not ready to accept that discipline.
There is a pseudo intelligence.
Yeah.
And with that pseudo intelligence, using artificial intelligence, they know what to do or not to do.
Yeah.
But the real intelligence never surfaces.
Yeah.
Just do what should be done.
True. There is preventive cardiology and there is reactive cardiology. Where do you think India stands today?
See, actually, honestly speaking, we as a nation, we should focus and do a lot more in preventive cardiology. But what has happened, the preventive cardiology is actually, that is how our culture has evolved.
True.
We have always concentrated more on building preventive aspects than the treating aspects.
True.
But unfortunately, over time, because of rapid urbanization, because of rapid modernization, we are more treatment focused.
True.
We are more concentrating on treating an event rather than preventing it.
Yes.
So it is. I always say, even I used to lament that our government of India, even if you see the budget, you know what is the allocation of healthcare budget is hardly to 1%, 2%, very very less for such a large country. Whereas we have budgeting for so many other things. I feel that unless otherwise, it has to come from the person individually and the government.
Okay.
Concentrate more on healthcare, preventive aspects, and we should be very, very strict in disallowing lot of toxic things have come in here.
Yes.
Either mostly in the form of artificial foods, wrong eateries, wrong drinks, and again, many governments they make alcohol as one of the major things for their profits.
Yes.
Again, screws the health of a lot of people. All this has to be dealt with.
Yeah.
So I feel that in my lifetime, I don't know whether it will happen, but we really pray that we get some sensible deciding authorities who should make sure that health may be the best wealth, and there is a lot of investment should go into creating wealth on the physical level, because now everybody is on creating wealth, the so-called materialistic wealth, but not the physical health.
Yeah, and actually that creation of material wealth and not internally being strong is actually, it becomes a hamper for the future generations, because they don't see the value of holding or being grounded. They see how they can get gratified quickly, and that is a problem, as you said. Yeah, it is very true. Alcohol or meth and all those things that are being imported into India, which needs to be curtailed, not just think about profits, but the future generations is very important to be protected. I agree, doctor. Yeah. So if you look at the next 10 years, how do you think cardiology as a field, or fundamentally what changes can be observed in cardiology?
In fact, I pray that the following changes happen. Rather than the way it's going is, I don't think it's going in the correct direction, especially with the explosion of the treatment modalities. I want the cardiology should get grounded. What I mean is, I feel every cardiac patient deserves to be assessed well, deserves to be decided based on group discussions, and the treatment should be very clearly
Documented.
that it makes a good positive thing to the patient. Patient should become better. And so I feel that we have to slow down. I feel we are too fast now.
Okay.
This way, I feel that it's not going in the correct speed.
Understood.
So that's what I am telling you. We are actually, as I told you, we have excellent gadgets. We are very, very highly intelligent doctors, excellent treatment modalities. Everything is fine. But I feel the speed with which things happen are very fast.
Okay.
So I want the next 10 years, we pray that things slow down. When I say slow down in favor of patients. That patients should be given more time. Patients know what's happening. Patients feel that after the treatment I am better, and that type of things should happen. Patients should not feel that they are taken for a ride. Patients should not feel that they have spent a lot of money.
Yeah.
Patients should not feel that whether it's necessary or not. All those questions should never come to the patient's mind.
Understood. Sure.
I really pray for that.
You mentioned that communication is important at every level, even in our previous question, and even in our conversations when we had earlier on. You said how important communication is, and in cardiology, especially, right? How critical is it beyond clinical knowledge that communication is important? How critical is it?
See,
Sorry.
I would say that the most important thing in a patient-doctor relationship, not just cardiology, anywhere, is communication. And why I say this, especially when you are in an emergency, your patient is in emergency, their communication is secondary. You have to act, you have to do something to make patients better. And whereas once a patient is not an emergency, patient has to be treated. Their communication is of a paramount importance for the following reasons.
True.
Number one, communication gives a lot of insight to the doctor about what exactly is happening to the patient. So what we call it the root cause of many issues we may know by communication. In fact, communication starts with what we call it the art of history taking in medicine. In fact, all of us as young doctors are taught history taking. But now it is overlooked. People now, what happens is people, somebody else takes a history. They just fill up questions. And that questions are answered by the patient and it comes on a screen. And many times doctors, okay, these are all the things history is taken. Then they go to the patient, examine and then, oh, I feel honestly, a few words of communication between doctor and patient is very, very important. It gives confidence to the patient, and it gives confidence to the doctor also that the patient has a trust on them. So, number two, either a good or a bad, a doctor should know the tact of communicating it in a very positive way. In fact, as you may know that I'm more an administrator now, I take care of the hospital. Everything somebody should know to communicate it positively. I always say, in the meeting also I said that somebody was telling, don't do this. They were telling that. I said, never say that negative word. We always say, be better if you do it that way. It's a communication, meaning is the same. So never use negative words like no, don't, and why. All that is avoid. Try to put it in a positive perspective. Still, what you want. Never say a patient get out. You please tell that it would be nice if you can leave this place. Communication is the one which is very important. And tone of communication. And one important thing which I want to stress: you have to be honest. I'll tell you, patients, because every patient is another human being. See, when I am talking to you and you are talking to me, I feel I should know your honesty. And I honestly feel that you have been so honest in asking me certain things. I read that, and I am very honest in answering you back. That's the most important stuff. Any communication.
So the trust building has to happen.
Yes. Yeah, and you have to be truly train yourself for that. I say that you cannot have something in mind and talk something else outside. It cannot happen. But some people are very, very talented in doing that regularly. If you do that as a doctor, patient picks it up within no time. They know when you talk to a patient, after some time the patient, in fact I have seen that happening when my juniors interact. That some patients have come and told this, your new junior doctor, this person is very good, sir. He's very good. And they have said, so this person is horrible, sir. I don't know. They are very, very arrogant. See, that type of, patients immediately know who is not good. So communication is very, very important.
So, like as you said, doctor, communication is so important that even with simply communicating a little of the patient's health could also improve, right? And because they have built that kind of trust with you, and that's so nice. So you have been teaching. You have since how long you have been a professor, doctor?
Actually, I came to PSG institution as a young cardiologist in the year 1994. I was 30 years old. Now I became a professor of cardiology in the year 2004. Now it's about 22 years since I became a professor of cardiology. I was practicing active cardiology till 2019. And now I guide patients. I don't actively practice. And now I head the PSG institution as a director of the hospital. So in that way, I have had a very long academic stint. I had almost, I told you, 94 to 2000 now. Still, I'm now. If you take from my MBBS days, it's quite a very long history. So 40 years since I've completed my MBBS.
Right.
So having said, I had a very long stint of academic journey.
Yeah. Yeah. So you have taught both UG and PG students, right?
Yes, yes. We used to teach. Now here we have even DM cardiology also was started here by me in 2010
Oh,
in
you
PSG.
started. Okay, nice.
Yeah, we have ongoing, and so we have taught the three levels. We have taught undergraduates, postgraduates, and postgraduates. Three levels.
Nice, nice. In the medical education system in India, what do you think is missing and what do you think needs to be incorporated?
See, the medical education, what we learned and was purely based on the history taking, clinical examination, and gadgets were secondary. So we were taught more as a traditional medical school teaching. Now, actually, it is started shifting, where there is comparatively lesser importance given to this, and more importance is given to the gadgets and the treatment aspects of it. I feel that this balance should exist.
Okay.
See, clinical examination, history taking should be still be given importance.
Very true.
At the same time, you should never forego the latest.
Yes.
So you have to, what you see, like how you see a television in your house. You have some certain things you may fancy. Your children may fancy something different.
Yes.
So you have to balance.
Yes.
You have to balance. Especially in a family, you can't have two televisions, and you would be very comfortable to have your children in front of you to see what they want to see, rather than them seeing it privately.
Yes.
So that is exactly should happen in the medicine also. The older and the newer school should somewhere be balanced.
Understood. Your analogies are very interesting, doctor. Yeah. So, how do you why did you pick teaching as one of the career paths?
That's my nature. I think from my childhood, because why I say this, even in schools, I have taught my fellow students.
Okay.
In MBBS, I have taken classes. I used to, my way of refreshing, because I always say that when you read, you what you call as you have an imprint of that. It is in your memory. When you teach, you learn better.
Yeah.
Because you are able to explain it, so your understanding of the concept becomes better. So I always was, even as a MBBS student, at the exam time, there are about 10-15 of my classmates used to come for my classes. I used to make them sit, and I will teach them medicine. I taught them the OG or surgery. I tell them this is how. So they are very happy because they get it. I'm more happy because I revised it.
Okay.
This is how the equation goes, and that continue.
Understood.
Even now I'm telling you, see, when you talk to somebody, it's like not exactly a teaching, but there
Sharing
is
knowledge.
there is analysis, internal analysis before every word comes out.
True.
So that way it is very, very useful, and it was very natural and inherent for me. So I never made any special efforts for that.
So that means to say your students are very lucky because they will be listening to a simplified version of any crucial or complex concept from you.
Absolutely. In fact, to tell honestly, recently there were about for 3-4 nursing students who are all in US now. They came for the alumni meet. They came and said that one girl started telling me what I taught her in cardiology. So she said, I think some corollary I had given as something like that. Because my way of teaching, I always give some examples for them to understand it easier.
Analogy, okay.
Small analogies. So that way, because as when I was here, I have taken some classes for the nursing students also.
Okay.
Now, after 30 years, that girl comes and tells me that, you taught me cardiology at IIM. So I take it as with a lot of humble feeling, but it's nice. It gives you such a fantastic happiness inside that we are able to tell that. And
Yeah.
So they should. It's nice to be always a teacher.
Nice, doctor. So you have joined PSG as a cardiologist, and then you were also a professor, and then now you are one of the leaders there.
Yeah, it's like a football team again. My analogy. Everybody gets to start the career as a footballer. You play, then you become a captain, then you become a coach, and you have a choice to become owner of the team also.
Yeah.
But I opted for the last level. I'm a coach now, and I'm happy with that.
Okay. Okay. So, doctor, what led to this change? I know you went to Dubai also as, and sorry, UAE, and you have served there also. Can you please help us with that journey?
Actually, I joined PSG in 1994. After 20 years, I had an opportunity by one of my mentors, a good friend of mine, calling me, giving me an offer to start to run a hospital there as an administrator. Actually, I went to Abu Dhabi precisely. It was Agalia group of institutions. They had built their multi-speciality new brand hospital, and I was given an opportunity to started from day one. There, Abu Dhabi has a lot of stringencies. You have a licensing exam you have to pass. The hospital has to pass.
Okay.
The Abu Dhabi health authorities will send a team of 10, 12 people. They will come inspect the facility, interact with the to be employed people,
Okay.
and they have to accredit everything is fine. Then only they will give a license for you to practice. Then the insurance companies will come. It is not like you can just open a hospital and you can't do that in Abu Dhabi.
Okay.
So we went through all this. Then we went through a very stringent a quality group called as Joint Commission International, called as JCI.
Okay.
So that I realized that this gave me a small shift in my interest. In fact, in 2010 itself, I did my MBA. I'm actually an MBA in healthcare administration.
Okay.
I remember my son was studying for his engineering, and I was studying for my MBA.
Okay.
We were both used to get up in the morning and study in different rooms. So I used to take notes and study, and he will come and say, "What are you doing?" I said, "No, what I studied the same way I should study from MBA. I have 18 subjects.
Okay.
I passed it, we did well." So I had an sort of somewhere I felt that I should change gears. I started liking the medical administration.
Okay.
My most important interest in me was the strategies. So I used to strategize the way things should happen, and my biggest plus point was I always took my team along well. The communication was my strongest point, and I felt that the team was very, very strong, well built. So I had to come back to the PSG. I left PSG actually as a professor of cardiology.
Okay.
So the PSG said that why can't you take over the super specialty division as head?
Okay.
So I came back and I continued as administrator, and till date I am doing that.
Oh, nice, nice. So, as an administrator, as a leader, do you see gaps? And I mean, I definitely know that you would have done a lot of contributions. You also mentioned in our earlier conversations, you started one of the units. So, what kind of gaps do you see, and how difficult is it to run the systems in a hospital?
It is, I'll tell you, yesterday we had I thought I have one unique committee called a solutions committee.
Oh, okay.
I tell you what it is. Because I always say that every complaint which comes to the hospital, it has to be documented. They have a root cause analysis, and then give a solution. And that solution should be discussed in this meeting. So monthly we used to have around 20 to 25 such things. Some come through mail, some come through personal. Everything is documented, and the team should elaborate that. So what I say that now what we really find it very difficult is many hospitals, many places, people work as islands. Islands, like separate.
Islanders, okay, yes, yes, yes.
Islands. Like, for example, if you take the reception, they will do their job very well.
Yes.
Now, from the reception, patient goes to a outpatient department. Outpatient department, they do very well. Now,
Independently.
where the gap,
Ah,
when the patient in the outpatient department, then they say that I need to go for a billing. Then they'll say, okay, go down, there you go.
yeah.
And he goes to billing. Then billing person will say, see, look here, you have been billed wrongly for the test. So
Yes.
the patient says, so what should I do? You go back to OP. You go back to outpatient and get it correct.
Hmm.
Now, this is the gap. What the patient should never roam around in the hospital for lack of communication between two departments.
Yes. Yes.
Because every department are very, very proficient in their work,
Correct.
but they don't do anything more than that. They are in a circle.
There is-
That's why they work as an island.
Yeah.
And many a times these islands are created by egos. Either ego of the person or ego of the department.
Department. Yeah.
They feel it is something like, I even now when I walk, I see a small or chocolate paper on the ground. I will never hesitate. I'll take that and go put it in the basket. This is my way of looking at it. But many a times, what I have seen, somebody will come, they will call the housekeeping.
Yeah.
Then they show the chocolate paper. Please
Yeah.
take it, put it.
Yeah. It's not
Now,
my job.
that it's not my job is killing institutions. And when this is the most affected is the customer or the consumer who comes in.
Yeah. Yeah.
So every institution, if you let it be a restaurant or hotel or hospital, if they work without that gap,
Yes.
they are very successful. And I'll tell you, everybody knows what to do. They know their job very clearly.
Correct.
But that stops there.
Ah.
It's not that you can deliver a good service to somebody just by knowing your job.
Yes.
You should know how a team approach to that service is.
Yes.
That is what I am trying to do. And I always say that an institution becomes successful only if there is a team spirit, only if they break the barrier and say that nobody should feel it is not my job.
Correct.
They come out and say that I will do this.
Yeah.
And there I quote this many a times, that is what exactly is the Karma Yoga, what is many a times is misunderstood. Karma Yoga, many people say that do your duty, don't expect the return. But it's not, Karma Yoga has never said that. Karma Yoga says do your duty. Whatever the result,
That's it. Yeah.
it may be a reward, it may be a criticism, it may be none. Don't expect. Just fine. Do your job and just keep doing.
Accepted.
Like you are asking me a question, I have to answer. I will do my best. Whether it's good or how, I don't know, but I will see. I will do my best to get out.
Super, super. As a head of the institute, how do you balance the clinical quality that is being offered there, operational efficiency, and financial sustainability? All of these.
See, basically, I am very, very fond of creating systems.
Okay.
I'm very fond of getting in the newer, especially the digital solutions. In fact, I'm very happy to say that our hospital is fully evolved digital hospital.
Oh, wow.
And this last 6 years, I ensured that we are one of the first largest hospitals to have started electronic medical records totally in all levels.
Wow.
And we have everything here is we manage it digitally. So whether it's quality assessment or the financials or dashboards are very clearly done for us to know what's happening day to day. And so that way, I learned this in Abu Dhabi. Abu Dhabi, I was given a lot of free hand to decide certain things.
Okay.
So I want to run the hospital as a smart hospital. A smart hospital is one where you use these gadgets in a smart way to make sure that the patient is taken care well. So now, earlier, I know when I joined here, patient used to come at 8 o'clock. His case sheet will reach the outpatient only at 9 o'clock. So, Now, you just touch the button, the patient gets registered, he goes to OP, it's already there in the screen, the
Ah,
doctor's screen.
understood.
So that way, every digital solution gives something which is nice to the patient. But there we found that because of digital solution, patient said, "Sir, doctor nowadays don't even look at me; they are looking only at the screen." So then I told the doctors, I made somebody to do the typing job and
Okay.
made doctors to sit and so
Okay.
everywhere you use plus there is a minus. They
Right.
always come together.
Ah.
It's plus. So plus and minus, this is plus and this is either this minus. So that is how it is.
Nice. Everything has
So most important, yeah, it has to go in that way.
understood. Everything has pros and cons, and you have been exceptionally good at establishing systems, that to digital systems, to ease the work. That's amazing, doctor. So you have already explored digitization of your system, right? Now, how do you see AI playing its part in both hospital management and clinical systems in itself, in going forward?
Yeah, in fact, now I feel this. I want to tell you honestly. Now there are so many software companies bombarding the healthcare providers like me with solutions. They say that we have a AI solution for your this that. So politely, and I listen to them politely and ask them, you all seem to be having a solution for us without knowing what our problem is.
Okay.
I'm not joking.
Yeah.
I'll tell you, Pushpaji, I've seen people having so many solutions. They have so many things without really knowing what our problem is. In
Yes.
fact, that drove me for me to have taken my latest avatar. I have started mentoring companies now.
Ah.
Now there are companies who are taking my role as a mentor.
Wow.
Now, what do I mentor? Because many a times when they come and tell me we have this product, this product will do this. So I fine tune them. I tell them, see, you have a product without knowing the issues which the doctor faces. Because we are on this side, so I know what I want.
Yeah.
I know what my patient needs. I know what the system needs. So please, you have to refine.
Yes.
That's why they call it refine.
Yeah.
Refine retune,
Yeah.
fine tune your product to our needs. And I've been very very happy to say that I've been very successful in that. And now only thing is I'm pressurized by more and more, so I have limited mentoring. And now I've limited a few exact because I balance my life. Don't overdo things this way or that way. So I ensure that I'm mentoring certain companies very clearly, giving them an idea that this is how it should be.
Nice. That's very nice, doctor. I think, yeah, even for our product, Gumber, that we are building, the HR platform for healthcare professionals, we have a set of doctors who are helping us from Villupuram. Our MD is himself a doctor. And yeah, definitely, I think I would need your guidance also to make this better. I'll approach.
There are many, I have interacted with a lot of HR agencies. Okay, sometimes I get a call. Recently, also somebody called me, said, "Sir, are you available for a job?" Then first thing I tell them is, "You that means you don't know me.
Yes. Yes.
If you are calling me, you should know who I am. I'm a cardiologist,
Yeah.
but I'm not a cardiologist. I don't know. That's it. So then that is I'm telling you this is exactly what is happening. So people should do, and I know many this representatives, medical representatives, they are all they were not scared of me because they will say that, sir, I've been asked to brief this product, please teach me. So I'll tell you, before you talk about a product, you should know the product well.
Yeah. Yeah.
Be very clear.
Yes.
So you can't go and tell a doctor, you please write this will happen. And I used to ask them, okay, you tell me what is the basic.
Nobody knows.
So that way, so many a times, I'll tell you briefly, if you look at the HR needs of somebody, that itself has to be multiple verticals are there.
Yes.
And depends on what type of hospital. See, we are a hybrid hospital. I have a medical college. a huge medical college, I have a multi-speciality, and I have a nursing college, I have a pharmacy college. So when somebody comes and asks us something, somebody came, do you want nurses? I said, we have a nursing college. So what I try to say is you should know what exactly is the need
Yeah.
and then approach accordingly.
Correct. Yeah, true. Without understanding your needs, there is no point in building products. I agree. So, yeah, at Blumber, we are addressing that one also. We always ensure that I, especially as a product person who is leading the product, I ensure that I speak to a lot of people out there, a lot of doctors, a lot of healthcare professionals who have been contributing in the field, and try to understand the pains and come up with solutions in tailoring it to them. But I'm not saying 100% tailored. Yeah, I'm trying.
I can always, at some time you think that I can be of some guidance to help you, it will be done.
Great, great. I'll definitely approach you, doctor. Okay, so you have been practicing cardiology for decades right now, right? Especially, so what does service truly mean at this stage of life?
See, I'll tell you, you have to be very clear. The diseases, I told you the same concept. You have to take care of your mind, you have to take care of your body, you have to take care of what you do every day. Your daily routine is a lot to do with how. So I say that if you keep your body reasonably healthy with proper food, proper rest, proper exercise, and keep your mind positive. Everybody gets negative ideas, everybody gets wrong things, but don't let that fill your mind fully. Try to, when negative things come inside, you just be a witness, let it go off.
Yeah.
And so, mind body balance. Very disciplined routine.
Yeah.
I'll tell you, my patients love me because I never say a patient don't do anything. I say do whatever you want, but be in moderation.
Okay.
Never overdo anything.
Okay.
Never overdo anything for that matter, either good or bad or eat or sleep. Be in moderation. Be optimum is enough, not that.
Extremes is not.
I tell you, that is why a lot of people are dying like flies in over exercise. They don't exercise. Or you totally over exercise and kill yourself. Never do that. That way, I feel that currently you have to make sure that you have, most important thing is you have to have good sleep, good food habits, adequate exercise, and a positive mind, a strong daily routine. And you have to be extremely grateful for whatever it is. So if you are grateful, you are always grounded and rooted. Never think that, you can do this, you can do that. You be happy about whatever you can do. And never be a nuisance to somebody. You be a good to yourself and to your society. I think that balance is what is important. And even today, I'm very fond of saying this small things. The biggest success for you is to have a good peace of mind. That's very important because success is not your money, this, that. That's all important. I don't say. But at the end of the day, you have to be comfortable here inside. You have to. And that's how I would share this for my fellows.
Yes. Okay, a couple more questions, doctor. I know I have taken a lot of your time, but yeah, you had earlier when during our conversations, you had mentioned that how a relationship being unconditional is important, right? How has that principle shaped your leadership?
I should thank my close friend. I told you when I joined MBBS, somebody was teaching me to speak English. His Dr. Babuji, he lives in US now. Now Babuji is the one who introduced me the term this conditional and unconditional. So that he used this word for. He told me, I remember. When on that time, Babuji used to be a very, very calm and very balanced boy. I used to be highly aggressive and emotional guy. So we were friends. So that way, one day when we were discussing something, I was very hungry. So when I'm hungry, I become angry.
Okay.
So I was very aggressive on him. He was quietly listening to all that, and after all that is over, then after I ate, I said, "I'm sorry, da, I should not have spoken like that." He smiled and said, "My friendship to you is unconditional." That's the first time I heard that word unconditional. Then I asked, "What do you mean by that?" He said, "See, I have not become your friend because you treat me nicely, you talk to me only good words. Never. You are my friend. You fire at me, you yell at me, you are my even because I am not your friend because of your conversations, but because for who you are." I'll tell you that has opened my inner eyes. See, anything in life, I'll tell you, then it's unconditional because conditional means you take something for granted. Once you take somebody for granted, then there is an issue. So unconditional is that you accept the person as who they are.
As he is. Okay.
I should accept my spouse, my daughter, my son, my colleague. I cannot expect them to be the way I want them. It never happens.
Correct.
So that way, that is what I mean by so anything condition. For example, if you start liking moving with another friend of yours because that person okay now doesn't what do you call it, doesn't talk ill of somebody, something like that. So if once you see them talking ill of them, you have a right to tell them politely that you can avoid doing it. But what I try to say is, if you have a friendship on a basis of something, any relationship, it's shaky once you know that they don't stick on.
True.
So that is
Unconditional. Doctor, so it has been a very demanding career for you, right? In all this, how has your family helped you to stay grounded, and how has that shaped you?
Again, I'm very thankful to God that I have somebody who is with me for the last 39 years. We were married in 1987. I will give the full highest credit to that person who has been with me as a strong support for me. See, when we got married, I was a student, and she was. I always say that she was a full-time wife, full-time mother to my children.
Okay.
And I say that, in a family, except that now it demands that everybody works.
Yeah.
You can always work because children needs your time. Children needs mother's time because many a times fathers are different. Now these ideas are now have to be very carefully expressed because the society is looking at these things in a very different way.
Yeah.
But I find it, I'm very clear about what I'm talking.
Yes.
So in that way, so when I was the first initial 15 years of my profession, I was extremely busy. I used to work 12 to 16 hours a day. So at that time and all, I leave very early, I used to come late. So only some breaks in between only we could all go out. Otherwise, my wife was there always for the children, and the children have been she was taking care. So they never missed the parenting. Number two, after I entered the second phase of my life, when the children were grown up, then we had to really make sure that they get educated well and they get married. That is phase two. We did that also. Now we are in the phase 3. Actually, our dharmas, they say that, brahmacharya, grahastham, and this actually the vanaprastham. So we are in the stage of vanaprastham where we are coming back to the reality. Now only because the children are grown, they are all settled abroad, the grandchildren are there. Anyway, we keep seeing them, meeting them, but only the reality is we only there for each other. My circle, she has her circle. We respect each other, and I feel the highest form of love is respect. Many do not understand that. When you love somebody, you can take them for granted. Never. When you love somebody, you should know to respect them, respect their ideas, respect their feelings. That has been our strength. So I was not like that 15 years. Now I am like that. So in that way, she has been always like that. She has never changed. She has been always good. I was not so good. No, I have become also good. That's how I look at it. So, and now we know that after the Vanaprastha, there is something called as sannyasa. That's how the tradition says. So, in a way, we have to
Transition one after.
It should be it's exactly the English word transcendenting.
Yeah.
It is not that you have done this from next day. It's not like that. Slowly you become like how you should know to what is important in life. So in that way, I feel that the more than anything, the mind should transform.
Yeah.
And the transformation is sometimes it happens after event, but sometimes it's very natural and this thing. So I would give the highest credit to my family support, especially my wife, and my I have a loving brother and his family, and children are there. I have some senior elders, and I have some very good colleagues in the working place
Okay.
who are very supportive of me and who are supportive. I'm thankful to God that and I'm liked, and I like what in me is I'm always a very down to earth person. I never go around with any ahankar or ego. I try to be nice, so people like me generally. It's very rarely I get angry or upset. Otherwise, I'm very down to earth guy. So
Principals talk about your character themselves. I mean, it's something very rare these days. It's really good. You have also been a musician, doctor. Like you sing. I think you're a state musician, right? State appointed.
yeah, actually, yes, I have sung with SPB sir. I have sung, given program with Arada Shiram. I've sung with Usha Udut madam. I've sung in front of TMS sir.
No.
I've sung in the orchestra of MSC sir. Somehow I was actually when I was very young I used to sing. I've never learned music in a proper way, but I can sing Carnatic songs reasonably well without the proper this things, because my strength was my voice and my talam are very good.
Good.
Having said that, I've been still enjoying my stage singing. Now, my main genre is the old songs which I have. In fact, next week I have a program with one of the gated communities. They invite me as a guest to entertain them.
Oh.
I take a small karaoke group, go with them. I enjoy, they enjoy, and it's very nice. Some old songs, in every language you have old songs.
Yeah.
So, and I continue doing it. I sing in big stages also with some of the new songs, with jig band songs also. I think, but now I don't like that much. I like to sing some melodious things and notes and things. When I think yesterday we had a Mandala Puja, and since I sang a few songs, but I just shared that reel also today in Insta and Facebook. I'm active all that. Just for information, I run a YouTube channel.
Oh.
It's my main important interest is to give short medical newses in the local language.
Yeah.
I have around 12,500 followers now. So very organically grown, not in any other way. But I'm very happy with that. I have a lot of
I saw a couple of them when you shared them with me. Yeah. So, doctor, one question I have now that did you feel that music and all this has helped you de-stress yourself or?
Very much.
Okay.
Before even you are completing the question, I'm jumping to that. See, I'll tell you, it is logic, emotion balance. See, I always say that the most important thing for us is to get involved with what we do. And we should come out of it like that. This is exactly what is portrayed as water on the lotus leaf. So you are there, but you are not there.
Yes.
So the success of anything what you do is your true involvement in what it is. Once it's over, you should know to come out as if it has never happened. So that is the whole. I always look into music. I enjoy. Now, for example, this podcast also from the time we have been speaking. Now I'm so involved. I don't see anything. I don't see me doing you a favor or I will make a favor. Nothing. I'm just enjoying it.
Yeah.
That is how I enjoy my music also.
Amazing.
I will enjoy whatever I do.
Yeah.
So in that way, what you get out of it. My profession has been like this. I have always enjoyed my profession, so I've never felt tired, this, that. So when I'm full
Flow. In the moment.
that way, I say that music really stabilizes. Music really, I'll tell you, most of the achievers, successful people are somewhere, or I told you even earlier that
Yes, yes. Yeah.
they will be well. That's how it is.
Amazing, doctor. It's a wonderful journey and wonderful insights you provided. And I really think this exchange that we had today, it's not just about learning your journey or just understanding what cardiology is, but it has come, as you said, right, from the deeper heart. And the exchange has been there has been a trust built, and you were so sweet to answer so many questions of mine. I really appreciate you helping me with that, doctor. Thank you so much.
And actually, I'm ending this podcast with a very positive note that thank you for choosing me. Thank you for giving me an opportunity to express myself. You may think that you have taken my time. I see this conversation also has refining me. So I always say that none of us are 100% what we want to be.
Yes.
But I am very happy that this gave me a lot of insight. Many of your questions gave me insight, and I've answered as to my this thing to my best as honestly.
It
And
has come
so
out
I
well.
feel that some of my ideas, because for the younger generation and the younger generation of doctors, and so in fact patients also should now trust doctors. Now
Yes.
patients stop trusting doctors. That
Yes.
is very dangerous
Yes.
because with both of them, it's the same thing is happening even in the married lives. The people are not able to accept. Everybody wants, as you were telling, they want everything fast, everything this, that.
Yeah.
So that jigs the Josh of the day, people forget so many simpler things. But anyway, I feel that I want to conclude saying that I'm very grateful to you for your patience with me and giving me a lot of thing to think. And I wish you all the very best for your podcast. I wish you all the very best for your company to do well. And as I told you, I will be always there at
Thank
some
you.
way for you. Whenever you seek my guidance, I'll be around.
Thank you so much, doctor. I really appreciate that. And I must say, yes, today's priorities are very different. And it's really hard to understand how they prioritize things the way they are being prioritized. The thinking has been different. But yes, guidance from greats like yourself will always help the younger minds to recalibrate what they are thinking into the right direction. So I really thank you for all of your insights and inputs. Thank you so much. Really grateful to have you on our podcast today.